and I'm the head in Department of Pharmaceutical Biology in Faculty of Pharmaceutical Sciences in UCSI University. So this is our campus. This campus is actually, we have 3 campuses. This is actually near to KL. If anyone visit Malaysia, you can meet me in UCSI University. Always we are welcoming you. Today, actually, we want to talk about what is that benefit of nanofiber, especially in the wound healing. So you can see here, nanofiber is look like a nanoparticle. The size is the nano range. Actually, nanofibers look like a thread-like appearance. We can use this type of fiber in various applications. For example, we can use this in wound dressing. So this will be facilitate the wound contractions. Also, we can use in the biosensor system to improve the sensitivity of instrument. For example, like a BP instrument, blood glucose instrument, pH meter. We can use the nanofiber to improve the activity or sensitivity of these type of instrument. Also, we can use in tissue engineering. We can place in the tissues for the regeneration or regrowth of the tissues in the particular region. Okay. Also, we can use this type of nanofiber for drug delivery. Any type of drugs we can load in the nanofiber, we can deliver in any part of the human body. Whenever we talk about the wound management, it is not started recently. It is started 5 million ago. So that time itself, actually, they talk about how we can wash the wound, how we can make the plaster, how we can use the bandage to cure the wound. So these all actually they're written in the tablet, actually is a clay stone. In olden days, we use the stone to write all the information, like as a manuscript. Okay, so we all know wound is actually whenever any cut happen in the skin or torn or puncture, it can able to make a wound. Sometimes it will be acute wound, or sometimes it will be make a chronic type of wound. So acute wound, we can see the minimal injury with the minimal bleeding, but easily can able to cure acute type of wound. But chronic type of wound is very difficult to cure. Sometimes we need prolonged time to cure this type of chronic type of wound. You can see here there are different type of chronic wound we are seeing. Okay, so the first one, diabetic induced ulceration. Okay, if you not well manage the diabetic conditions, it will be leads to this type of wound. Sometimes we are going for the amputation as well. So next you can see here, this is actually bed sore wound, or we can say is the pressure ulceration wound. When the patients are actually bedridden patients are bound with the wheelchair, they cannot able to move. So easily this type of wound can occur in this type of patient. Or we can see here, this is the ulceration in the leg. Okay, so whenever if any disease in the artery or vein, the blood supplies are decreased to the particular regions. So we can see the swelling. That swelling will be leads to the chronic type of wound. And also we can see sometimes when you have met injury or any accident, so we lost our tissues, right? So this also sometimes can cause the chronic type of wound. So we need to treat prolonged time to cure this type of chronic type of wound. When we see the stages of normal wound healing, we can see the 4 type of stages. The first stage is the coagulation stage. We can see the platelet aggregations in order to stop the blood out of the tissues. Okay, so that is the first we can say is the homeostasis mechanism. So second, you can see the inflammations. So during that wound, some of the exudate proteins are migrate into the wound area. So that protein will cause the inflammation. Okay, but at the same time, we can see some antibacterial activity during this inflammation stage to avoid the infection in the particular wound area. Okay, so the neutrophils are lymphocyte cells are helping for the antibacterial action. So next, when you move to the third stage, okay, so there is the development of extracellular matrix like fibroblast, collagens are formed. It will be form the extracellular matrix in the tissues. Okay, so the final stage, we are seeing the complete formation of epidermis or dermis layer you can observe. This is called as the remodeling stage. So these 4 stages actually will be occur in normal type of wound. But what is the difference between diabetic wound and normal wound? When you see the normal wound, we can see the epidermal growth. Okay, so there is a formation of the keratinocyte cells will be formed the epidermis. Okay, so we can see the normal growth of dermis you can see. And also, as usual, when it can process the extracellular matrix like collagens, fibroblasts also can able to produce during normal type of wound. Also, some of the inflammatory substances like M2 substance, IL-10 like substance can help to cure the inflammations. Also, normal angiogenesis, it means the normal blood vessels will be formed during normal type of wound. But what is the challenges in the diabetic wound? Okay, so it cannot easily form the epidermal layer. Also, incomplete granules in tissues in the dermis layer. So dermis also cannot able to fully form. Okay, so when you see the blood vessels also is completely cannot able to form. Okay, so you can see some of the inflammatory marker like IL-6 marker you can see in the diabetic type of wound. Also, it produces the reactive oxygen species. So that oxygen species will be further damage our tissues. Okay, so this is the major difference between normal wound and diabetic wound. So what are the other challenges we are facing during chronic type of wound? That is the infections. Usually, normal type of wound easily can cure. Okay, so the infections are very low. But in a chronic type of wound, you can see in the wound area, the lot of water molecule you can see, some exudate you can see. So this exudate is actually help to grow the bacteria in the particular wound region. Okay, another major concern in chronic type of wound is lack of oxygen supply. As I said, there is a blood vessels cannot able to form during the chronic wound. So if you know that there is no any blood vessel, the oxygen also cannot able to deliver to the wound regions. That also will be delay the wound contractions. Okay, so also the extracellular matrix like fibroblast, collagen also is it take long time to produce in chronic type of wound. So when you see the prevalence of chronic wound, actually is a very major challenges. Both patients are clinicians because till now we don't have any ideal drugs for treat this type of chronic wound. Okay, so when the patients are getting chronic wound, really we all know that it will be affect the quality of life of the patients. This is a very major concern with the chronic type of wound. Also, when we see the epidemiology, almost 6 million people are suffering from chronic type of wound in the worldwide. Okay, so really we need to think about how we need to treat the chronic wound. Okay, as I said, in India, 4.5% per thousand populations are currently they are suffering from the chronic type of wound. As I said, it is maybe different type of diseases like diabetes. I said atherosclerosis, blood vessel damage, or any infection disease like tuberculosis, leprosy, or ulceration. These all actually can cause the chronic type of wound if we are not treated properly, right? So, and also the global chronic wound care managements are saying we are spending almost more than 10.41 billion USD we are spending. So that will be increase almost 16.81 USD billion in 2028. It means still we are keep on increasing the money for the treatment of chronic type of wound because we don't have any ideal treatment for the chronic wound. So what is the major challenges we are observing when we treat the wound? As I said, achieving the efficient. So higher efficacy type of substances or drugs we don't have until now. Okay, so that's why we are always facing the issues. And next, as I said, we need to take longer time to cure the disease. So the cost also will be high. So we need to always check how we can increase the cost of care. And next, whenever chronic type of wound, along with always we are having to treat the bacterial infections in the wound region, that is the other concern. Also, as I said, always the patients during chronic type of wound, they feel very pain. Okay, so improving the patient experience also is another challenges we are facing in the chronic type of wound. Okay, so it means, do we have any treatment for this type of chronic wound? Yes, of course, we have the treatment. We have gauze, film, fiber, hydrogel, hydrocolloid, foam, alginate. Okay, so this actually is a compositions of antibacterial substances you can see. Okay, so but what is the major challenges with the current drug therapy is actually the frequency. Okay, so if you apply morning time, then next afternoon we need to apply again, we need to apply at night time. So the frequency is high. Okay, but sometimes this type of gauze will be adhered to the wound regions. So whenever we remove, it's very difficult to remove from the wound regions. It also can cause some inflammation to the particular wound. It will be aggravate the wound, chronic type of wound. So apart from that type of formulations, we are going with the bioengineered tissue substitute. It means we are using some cadaver tissues to place on the chronic type of wound, but it helps to grow the skin in the wound region. But what is the major challenges we face during this type of treatment is the host rejection. Sometimes, our bodies will be reject the newer tissues. Okay. Also, when you see the cost of this type of treatment, almost when you're doing the surgery, more than 10,000 USD we need to spend. So that is the other concern with this type of treatment. Also, sometimes, we use the debridement technology. We use the knife, surgical knife, to remove the hard material, because, sometimes we can see hard material, it will be stop the oxygen supply to the wound region, so it will be delay the wound healing. So we are using that type of surgical knife to remove the hard material from the wound. But this is, you think is how painful. So it's a very, very low patient experience. Okay, so that's why to improve the patient experience during the treatment is actually we need to always look into that. Okay, so also we are using platelet growth technology, but this is actually also we need more money to develop the platelet growth technology. But sometimes this also will be make the inflammation in the wound regions. So also we need to see what is the newer drug therapies we can do it. Okay, so apart from we use the VAC therapy. Okay, so this is the instrument we are placing on the wound. Okay, so this instrument usually will be help to remove the unwanted hardened material. Okay, so to promote the growth. But this also, when we place this one, when you apply that negative pressure to that particular regions and remove the dead cell, also is very painful technology. So we can use other technology like hyperbaric oxygen therapy, but we are keeping the patients inside the chamber and we deliver the oxygen, right? So this oxygen will be help to move into the wound regions. So the wound will be actually this oxygen will be delivered to the wound region. So it will be help to easily cure the wound. But this is how we are giving. When we give oxygen, sometimes it will be collapse our lung system. Okay, so that's why these are very major concern whenever we talk about the chronic type of wound. Okay, so always when we want to make any ideal wound dressing, few things always we need to remember. Okay, so one, your drug therapy should be cost efficient. Everyone need to use that one. Okay, so that whatever substance you are using, it should be biodegradable. and also it should be very compatible with the tissues. Also, you should be control the infections. As I said, there will be the exudate, so we need to control the moist in the wound region. So always we need to think whenever we are making drugs for the chronic type of wound. Do you think that any treatment we can go with this ideal character? Do we have any treatment? Yes, of course. Okay, so nowadays we are moving to the nano. Okay, so because of a better delivery system, we are using the nano. Okay, so as I said, nano particles are like a cube, like a structures, but nanofibers look like a fiber, like a thread-like appearance. It having the nano size. Okay, because of the nano size, naked eye we cannot able to see the structures. By using the magnification like a SEM or CHEM, we can see the structure of the nanofiber. Okay. Because why actually we are selecting the nanofiber? When you see the structure is a 3D structure, okay, so it has a unique physical and chemical properties. So any small substances also we can load in the nanofiber. You can place in any very small deep wound also we can able to place the nanofiber. Okay, so that is a unique property we are observing with the nanofiber. Okay, so as I said, nanofiber, we can load any type of substance. Okay, so if you want to load your natural drugs, okay, so we can load it in the nanofiber. If you want to use any bioactive substances, also we can able to load into the nanofiber. We can load with the antibacterial drugs. Okay, also we are loading any small substances which can able to help the contraction of wound. We can go with the nanofiber. Okay, so it's very feasible to upload the coated with the phytochemicals. Okay, so that's why we can use this type of nanofiber. Okay, so there are different type of methodology we can use a nanofiber, like a MEL processing or polymerization technique, electrospinning technology also we are using. But in my research, actually, we go with the electrospinning technology because any very poorly soluble substances easily can able to make with the electrospinning technology. Okay, so whenever we use this technology, actually the cost is very low. Also, it can get 3D very nano size range of nanofiber we can get by using electrospinning technology. Okay, so as I said, by using electrospinning technology, we can use the acute type of wound. Also, you can cure the chronic type of wound. Okay. Okay, so now you can see here why actually I'm going with the electrospin nanofiber. By using this technology, you can get a nanofiber. That fiber is similar like the extracellular matrix on the skin. So because of that unique structures, when we place the nanofiber on the tissues, it's easily go and attach with the tissues. It helps for the regeneration of the tissues. Okay, so it can help for the easy production of the fibroblast, collagen, everything will be easily can able to form when we use the nanofiber. Okay, the second advantage is like a pore-like structures. As I said, is a fiber. Okay, so along with the fiber, you can see some pores. These pores help the exchange of gases. Because during chronic type of wound, as I said, lack of oxygen, right? So when you use this one, it will be deliver the oxygen to the wound regions. It will be help for the curing the wound. Also, this is look like a protective layer. So if any infections happen, so it will be stop the entry of bacteria to the inside of the tissues. So protect from the bacterial infections you can observe with the nanofiber. Okay, so and next it can shows the absorption of the wound exudate, because nanofiber is a dry form. Whenever the dried sheet when we apply on the wound is easily can able to absorb the exudate in the wound region. Okay, so electrospin, as I said, is a targeted delivery. Okay, so we can target on any type of diseases. So we can make like a biocompatible and biodegradable and non-toxic and non-allergic type of drug therapy or nanofiber drug therapy we can able to make. Okay, so now you can see how we can able to make a nanofiber by electrospin technology. So to make the nanofiber, so two things is really important. One, what you selected, drugs. Okay, so the drugs we should mix with the polymer. Okay, so these solutions we need to keep in the syringe. Okay, and here we attach with the needle. We are giving high voltage current to the needle. Okay, so whenever the solutions are coming out from the syringe, this high voltage will pull the solution into the collector region. Okay, so this effect we can call as the Taylor-Kahn effect. So Taylor-Kahn principle you can see in the electrospin nanofiber. Okay, so but before when you make that getting the nanofiber, okay, so we need to always optimize our formulations, because simply you cannot able to give the nanofiber. Okay, we need to optimize the solution and optimize the instrument. Okay, so first is the distance, deposition distance. You can see here the distance between the needle and collector region should be optimized, because if you keep very near to the needle, okay, so the solutions will be deposit like a water only. You won't get any fiber. Also, the distance will be very long. Okay, so whatever it make the fiber cannot able to deposit on the collector region. So we need to optimize the distance between the needle and collector region. That is one of the main important things. And next, polymer concentration. You think that if your polymer concentration is high, is it can able to come out from the needle? Cannot, right? So viscosity is very low. It means look like a liquid, so it cannot able to make a fiber. So the viscosity or polymer concentrations also is a very important role in making a nanofiber. Okay, and next, voltage. If you give high voltage, the voltage it will be evaporate the solution. Okay, if it is very low voltage, if you apply, solutions cannot able to make like a nanofiber. Okay, so that also we need to optimize. And next, flow rate. So because syringe we are keeping in the syringe pump. Okay, so we need to optimize the rate, because the rate is very high. It is very fast moving of the drugs from the syringe, so it will be deposited as a globules only. So it should take some time to make a nanofiber. So the flow rate also is another conditions we need to always check during the nanofiber. And needle diameter. Okay, so whenever we increase the size of the needle, like when you use the 21 gauge or 20 gauge, okay, so you can get the very small nano size of the nanofiber. Okay, but if you use very like 14 gauge or 15 gauge, okay, so we cannot able to make the nano size. So whenever you increase the size of the needle, then we can get very nano size range of nanofiber. Okay, so as I said, is we use the polymer. Okay, so to mix with the drugs, we are using natural sources. We are using synthetic sources as well. Okay, so depends upon what is your aim. Okay, because sometimes some of the polymer also shows the wound healing activity. Some of the polymer shows the antibacterial activity. So we can select the polymer based on what is your objective, what type of drugs you want to form nanofiber in the form of nanofiber. Okay, so protein based polymers are available, carbohydrate based polymer available, some synthetic polymer also is available. Okay, so we need to actually check as per your objective what you want to do. Okay, so now you can see here the chrysin curcumin loaded nanofiber. Okay, chrysin is a flavonoid. Both are actually is a natural substances only. They are loaded with the polymer PCL-PEG. What actually they observe? They actually apply the nanofiber on the wound. Okay, so within 14 days, more than 90% of contraction they observe. Okay. Also, when they studied about the drug release, more than 15 days drug release they observe. It means when we use the nanofiber, we can make a sustained release drug as well. Okay, so no need to frequently change the dressing in the wound area because of is a sustained release on long durations. And next you can see here metformin. Metformin we all know is the anti-diabetic drugs. Okay, so also it can help for the wound contractions. Okay, so they made nanofiber with the PLGA substances, polymer. Okay, so this also shows the more than 3 weeks drug release, sustained release it shows. Okay, so also you can see here more than 90% of wound contractions in 14 days it observed. Okay, so next another example. You can see estradiol and polyurethane dextran nanofiber. Okay, so this type of nanofiber also is shows the significant more than 95% of wound contractions we can observe with this type of nanofiber as well. Okay, so as I said, is not only the phytochemical, we can use any extract we can load it. Okay, so any epidermal growth factor you want to load, you can load. Okay, so according to that, actually, we need to select the nanofiber, and this will be help for re-epithelialization of wound you can observe with the antibacterial. If you select the polymer with the antibacterial polymer, it shows the antibacterial activity. Okay, so I think whenever we treat the chronic type of wound, okay, so we better to select with any drugs with the antibacterial wound contraction property because we need to control the infection also during the wound, right? Okay, so next here you can see allium sativum and Clio dracerifolia. Also, actually, they are loaded with the polymer, with the chitosan polymer. Chitosan also is a good antibacterial activity. So they use that polymer, and also you should actually, this also will be enhanced the. Okay, so as I said, any smaller molecule, vitamins, phytochemical, anything we can able to load. If you want to load a vitamin A or vitamin C, vitamin E, okay, we can load with along with any other your drugs, because you know vitamin A will be help for the angiogenesis, vitamin C is the antioxidant, vitamin E is the anti-inflammatory substance. So these all will be help for during the curing of chronic type of wound. Okay. So this is the instrument we are using. Okay, as I said, this is the electrospin instrument. Okay, so you can see here the voltage regulator. You can see syringe pump. Okay, so usually we place the syringe in the syringe pump, because the syringe pump will be help to regulate the movement of fluid from the syringe. Okay, so we can place the electrode because, as I said, we need to have the high voltage current. Okay, so this is the collector region. Okay, in the collector regions, we have two methods we can collect. One is the static method. Static method means it won't rotate. Okay, it plays like one place, it won't rotate. So this is actually the rotating drum. Okay, so this speed will be controlled by the speed controller. Okay, so first we need to prepare a polymer along with the solutions. We need to identify the concentration of your drugs and polymer. Okay, so mix together. Okay, and place in the syringe. Okay, so now, okay, so we need to rise the voltage. Okay, current. Okay, so we need to see and in which voltage, okay, the drug solution is making like a nanofiber and deposit in the collector region. Okay, so we need to optimize how much voltage you need, how much flow rate you need, and what is the distance between the collector region and syringe. These all we need to optimize. Okay, so actually, you can see here, we made electrospin alpha mangosteen loaded chitosan based nanofiber. We studied in the STZ induced diabetic model. we all know alpha mangosteen is a phytochemical, is obtained from the mangosteen fruits. Okay, so we actually started with the 0.3 pump rate, and voltage we started with the 8. Okay, so the distance between collector and syringe 15 we kept. Okay, so but during this actually we didn't get any fiber. Okay, so now we changed the voltage, and we checked again. That time also we didn't get any fiber. Okay, so then we actually changed the distance between the syringe and the collector region. So we got continuous jet-like fibrous mat-like structures actually we obtained in the collector region. Okay, so that's why I said so optimization is very important in to making the nanofiber. Okay, so once we get this one, okay, so we can check with the polymer also, or you can check with the drugs and polymer also. Okay, so we loaded 2% and 4% of the alpha mangosteens. We mixed with the chitosan and PEO polymer, and we made a nanofiber. Okay, so after that we send the sample for the SEM analysis. Okay, so you can see here we got 147, almost 214 nanometer range of the nano size range of fiber successfully we obtained by electrospinning nanofiber. Also, when we studied about the wound healing property, we studied actually in 14 days, you can see more than 80% of wound contractions with the 4% of solutions, 4% of nanofiber shows wound contractions when compared with the diabetic control. So successfully, we achieve our goal. Okay, so next we can see here the 4% of nanofiber. You can see epidermal growth, epidermal and dermal growth we observe in 4% of the nanofiber. Okay, and we send the sample for the histopathological examinations. From the examinations we observe, and in 2% alpha mangosteen nanofiber also can shows the fibroblast collagen, but the number of fibroblasts and collagens, more number of follicle cells and epidermis cells growth actually we all observe in 4% mangosteen fiber match. Okay, so also we use the polyvinyl alcohol 4% solution also we mix, we actually selected and mixed with the synthetic curcumin derivative drugs, and in presence of 0.5 ml per hour flow rate and voltage 12.5 kilovolt, the rotation speed is 125 rpm, we got nanofiber, and 170 and actually 171 nanometer range actually we observe the nanofiber, and it is actually act against the staphylococcus aureus. Okay, so what is actually finally I want to conclude from this talk actually, nanofiber is a one-time applications. As I said, the frequency we can reduce is an excellent healing property because of it is a unique physical and chemical structure. There is no any painful redressing. Okay, so the fibers look like a transparent sheet, so easily we can able to monitor what is actually how the contractions of the wound. Okay, so as I said, it can reduce the infections, also cost effective because one time if you buy the instrument, okay, so repeatedly we no need to spend the money for that. Okay, so only we are spending money for to buy the instrument. Okay, so in India, some of the institutions are like CSIR, SRM. Okay, some of the universities they are doing this type of nanofiber. In India, in UCSI University also we are doing nanofiber. If anyone want to collaborate in futures, we want to collaborate with the UCSI University. We are always welcoming you. Anytime actually we can do collaborations, and we are looking forward about the collaboration in future. So definitely nanofiber dressing can cure, heal the wound and promote the tissue regenerations in future. Definitely it will be going to hit in the wound care therapy. Thank you for your opportunity.